I want to thank everyone for joining us today. So Public Health 101 is part of our scholar program. It is something we haven't been able to do for the last few years because of COVID. So this is the first time we've been doing this since 2019, which is really exciting that we're able to get this back up and running. We're going to do an introduction of RIDOH to begin with, and then we are going to do an overview of the Academic Institute. So Seema Dixit will be joining us. She is the Deputy Director, and she'll be giving an introduction of the Department of Health.
Thank you, Jennifer. I'm trying to look at who all are on the call. Just trying to gauge the audience. Do you want me to get started?
Yeah, sure.
Okay. All right. So good morning, everyone. And this is very exciting. We started something similar maybe 18 years ago as a public health lunch and learn, because there's just so many aspects to the Department of Health, and it's fairly overwhelming when you start coming in and what exactly does the Department of Health do. So I'm excited that this has now become since the past many years, except the pandemic years, this has now become a routine that we do for public health scholars, as well as I always encourage new staff who are in the department to join, to kind of know some more faces other than the ones you see in the hallway or the elevator, and kind of get to know the department. So having said that, I'm Seema Dixit. I am the Deputy Director for Health at the Rhode Island Department of Health. I will be sharing a organizational structure with you, but keep in mind the purpose of that org chart is to share the different areas of the department, because it's not most up to date. The department has undergone a number of transitions in the past 27 some months since the pandemic first hit. But I'm the Deputy Director of Health. I have previously worked and I'm still holding the portfolio of overseeing the Environmental Health Division, which you will see on the org chart. Prior to that, I have worked in licensing on the third floor, which is licensing of healthcare professionals and facilities, customer services as it's called. Prior to that, I was with the Health Equity Institute for a few years. And then before that, infectious diseases. And then I started in the tobacco control program and then moved to the heart disease stroke prevention program on the fourth floor in the promotion area, and with a brief experience during all these 20 years also at the laboratory. So that's kind of what my background is. You can call the Department of Health my second home. Sometimes I spend more time at the department than elsewhere. I do consider it still as an honor. So having said that, Jennifer, do you mind moving to the next slide, please? So the Rhode Island Department of Health's overall overarching goal is to positively demonstrate for Rhode Islanders the purpose and the importance of public health. And having said that, about 7 years ago, we did we developed with our most recent permanent director, Dr. Alexander Scott. We underwent a series of discussions to come up with new leading health priorities, and which are displayed right now. The first one of them being address the socioeconomic and environmental determinants of health in Rhode Island, eliminate disparities of health in Rhode Island and promote equity, and ensure access to quality health services for Rhode Islanders, including a vulnerable population. So the first one, address socioeconomic and environmental determinants of health. What we believe very strongly as a department is the neighborhood, the place, the factors that influence your health and well-being, your demographic surrounding. Those are the ones that have a profound impact on health. So no matter what medications you take or how you do. So our most important in shaping what your health turns out to be. So we most certainly want to address those. And some examples of those are where you live. Do you have a place to walk? Do you have access to fresh fruits and vegetables? Are you exposed to any kind of air, water, soil pollution around you? Or just overall, do you have enough money to basically take care of your health, or at least eat healthy, or at least, have some level of healthy lifestyle in your life? Eliminate disparities of health and promote health equity, which is to ensure that everybody in Rhode Island There isn't just like few people who are living healthy lives and the rest of them are not. So that is our main concern, and our strategic priority is to remove disparities at every possible level: mental health, physical health, as well as anywhere. It's related to gender, related to income, related to where you live, related to what race you are, so on and so forth, just some areas. And the third is to ensure healthcare access for all Rhode Islanders, mostly our vulnerable populations, for those who don't have health insurance, for those who don't have financial ability, for those who don't have physical access. So how do we ensure that quality health services are accessible to everybody? So these are our strategic. So we try to base all our programs to follow these strategic priorities that we have. And then the cross-cutting ones are to ensure the integration of scholarly activities with public health, to make sure that we work very closely with the academic institutions in Rhode Island so that we are up to date with data that is local. So we have initiatives that collect data to see how things work or not, because our academic institutions not only conduct research at the local level, but are also training a new set of public health professionals and tomorrow's workforce. So how can we work very closely with them to at times give them a practical experience at the Department of Health, and at times to take experience and data from them to help make our programs better. And our second institute that we have is to promote collective action to achieve full potential of Rhode Islanders, which in simple terms is to work towards our leading priorities that I just discussed. Next slide, please. So I want you all to take to focus on this chart. Only in the bottom half of the chart, we don't have an updated organizational chart, but this pretty much defines the 6 different areas we are currently configured, starting with the Division of Policy, Information and Communication, which oversees all the communication that goes in. You may have seen billboards on the highway. You may have seen messages that come out of our Twitter, our Facebook, our Instagram page, our website. You may have seen little spots on the radio, on the TV about masking, not masking. You may have seen brochures at doctors' offices, at community health centers. All of that comes through our public health communication. We have the health data piece, where all the data that is collected in the state. We have the Center for Health Systems Policy and Regulation, how different policies are developed, and how different agencies that require policies and regulatory approaches work with the Department of Health to be in place. And then we have the Center for Policy Development and Strategy. The next division we have is the Division of State Laboratories and Medical Examiners. So state laboratories and medical examiners deal with all kind of testing for the state. So it's a state laboratory. So the beach water, to ensure the beach is safe, is tested here. Anything that contains lead, we have a concern, gets tested here. Any kind of drug overdose. If somebody is caught on the freeway and has a breath analyzer used on them to see if they are under influence, that gets sent here. All the biological stuff gets sent here to see if any food is safe for consumption, water is safe for consumption, any air quality testing. So all of that is done here. And the Center for Medical State Office of Medical Examiner is the one that does autopsies in the state. So any death that is suspicious, which could be a road accident, a homicide, a suicide, a drug overdose, any of those, they come to the state laboratory for autopsy to confirm the cause of death. So we are fairly busy because of all of that work that happens in the laboratory and other areas. The third box that you can see is the Division of Preparedness, Response, Infectious Disease and Emergency Medical Services, which is all of the emergency medical response, is all the 911s that people call when there is an emergency. We regulate and license them to make sure that they are following the protocol, make sure there is no delay, make sure that patients are taken care of, so on and so forth. Center for Emergency Preparedness and Response is the center that deals with the pandemic. COVID-19 was very big, but we had H1N1, we have had anthrax in the past. We sometimes have an emergency of a hurricane. We have emergency of flooding, of storms, electricity going out. So how does that make an impact on the health of the people who are impacted, and what can we do to make it better during such emergency situations, is something that is done by this center. The Center for HIV, Hepatitis, STDs, and TB, those are all disease-related centers. What that means is we conduct surveillance to make sure that data is collected, where the cases are, how many cases, what is the reason they are infected, blah, blah, blah. We do case management, which means we do contact tracing. In some cases, such as HIV, we connect them to services to make sure they are on medication so their viral loads remain low. And then we do surveillance, we do case management, and then we also referring them to treatment where the need be. And we also work to make sure this is preventable, such as, work with communications, work with testing, often work with, there's something called as PEP, which is post-exposure prophylaxis, so on and so forth. The Center for Acute, so the infectious diseases, the acute ones are the ones like which need an immediate response, such as salmonella, a food outbreak, E. coli, and 70-80 monkeypox, COVID-19, H1N1, so on and so forth. The chronic ones are the HIV, STD, TB. They are the hepatitis. They are the infectious diseases which spread through varied modes, but they are chronic, meaning people can live with them if treated appropriately under treatment. So it's not an acute response that is needed. Moving on to the next bucket of things, which is the Division of Community Health and Equity, which is again a health promotion and prevention related programs, which are community based. The Center for Chronic Care and Disease Management work with programs such as diseases that are chronic, such as diabetes, cancer, arthritis. What can be done? How can they be screened? How can people live healthy lifestyles, such as wear their sunscreen, get their mammograms done, get their prostate cancer screening done, ensure that they do diabetes management through eating healthy, through, taking their medications, doing their physical activity lifestyle, so on and so forth. Asthma also falls under that. Center for Health Promotion is the center that works with programs that are all focused on prevention, tobacco prevention, prescription drug and opioid overdose prevention, physical activity and nutrition prevention, suicide injury prevention, rape prevention in all age groups. So that's what the center deals with. Center for Perinatal Early Childhood Health, it focuses on how kids before they start school and starting when they are infants, how can they get the optimum nutrition, such as nutrition and health, such as is it a healthy environment for them at home? Do they have conditions at home that allow them, the parents, to take care, or the caregivers to take care of kids? The WIC program that you may have heard falls in this area. The Center for Preventive Services, the center that houses the immunization program and the school health program. You all may have heard, that's the program that handles all the COVID-19 vaccines, the hepatitis vaccines, the flu vaccines when the season comes, and the galore of vaccines that are given, measles, shingles, all of those that are given across the age group. School health program ensures that schools have wellness programs established in them, that there is a good adolescent sexual health program, there is good health education in high school, middle school, and as a part of the school curriculum. So that is the Center for Preventive Services. It also houses the oral health program, which works to make sure that those who have access to oral health care can also prevent them, such as kids and others. And those who don't have access, how can they access oral health services or dental treatments in the absence of insurance? So we work extensively with community health partners to do that. The next center, the next division that I'm still overseeing is the Division of Environmental Health, the Center for Healthy Homes and Environment. It houses programs such as lead prevention, lead screening, if kids who live in older homes don't inadvertently get exposed to lead poisoning through their old paint, chipped walls, chipped windows, so chipped lead paint, so on and so forth. It houses the climate change program, the environmental public health tracking network, the OSHA program, which is the occupational safety and hazard, to avoid people, to make sure people are working in safe conditions, wearing hard helmet, not tripping on electricity wires and so on and so forth. It also has the radon asbestos program. So before a house is sold, it gets a radon testing done. So we make sure that cities and towns are implementing that. That's the Center for Healthy Homes and Environment. The Center for Food Protection licenses all the food related entities in the state and conducts inspections to ensure all 7-Elevens, all places that manufacture processed foods, all the restaurants in Rhode Island are operating under hygienic and sanitary conditions. They are not serving food that is not stored at optimal temperatures. They are not having workers who are not healthy, not masked, so many and so forth. So making sure that the food Rhode Islanders get is healthy. The Center for Drinking Water Quality oversees the same for water to make sure that the water is not contaminated. There is no groundwater or other contamination. It also gives technical assistance to private well owners. And we also do the beach monitoring program and the swimming pool program to ensure that the beach water is safe and the swimming pools are constructed in a way that is safe, that abides by safety and is not hazardous or dangerous to people. The last is the customer services area, which is the Center for Professional Licensing Boards and Commissions, to ensure that anybody starting with a massage therapist or a nursing aide or a nurse up to a doctor, everybody in between, including barbers, anybody who handles people or deals with people physically is licensed, ensures that they are not abusing their power, ensure there's no wrong side surgery, there is no delay in healthcare, there is no medically licensed people who are not providing the optimal care to their patients. So that's that center. The next is Center for Vital Records, which issues birth certificates, death certificates, and marriage certificates to all Rhode Islanders. And then the Center for Health Facilities Regulations, which oversees all the hospitals, urgent cares, kidney dialysis centers, and anything that provides healthcare to Rhode Islanders. Next slide, please, Jennifer. So this is a very, very complex chart. I'm not even going to try to explain it, but we can share it for your understanding. So what we've done is, how do we have our priorities? How do we insert our priorities to make sure all our programs are following them, right? With all the funding that we receive. So we have the 3 strategic leading priorities. They go into the 5 strategies, and then we've developed the 23 population health goals. So this is something that should be studied more carefully to see how we implement those programs. So I wanted to keep my presentation short, just to kind of give you the basic overview of the Department of Health. There's more than 150 programs. With our pandemic hiring, there's more than 700 people, including contractors. And it's a big department. There's a lot of work that happens. So I wanted to make sure that there are a few minutes to answer any questions, Jennifer, if that's okay.
Yeah, that's great.
Yeah. So if you want to just focus on remove the slideshow, I'm happy to answer if people have any questions. Because I think I can't see if anybody's hand is up or.
I also cannot see because I'm sharing my screen.
Yeah, so maybe you can stop sharing the screen if people want to ask questions. If there are no questions, that's good. I'll assume it was clear. But if not, that's okay. Okay.
There we go.
Okay. People don't have to ask questions, but if they do, I'm happy to answer.
Hi, good morning. I'll ask a quick question.
Sure.
So my name is Kelly. I'm going to be working with the home visiting services this summer and hopefully into the fall. But thank you so much. That was a great presentation. Just I'm wondering, from your point of view, kind of like what area of RIDOH do you see like needs the most improvement or needs the most focus kind of right now? I know maybe COVID might be the obvious answer, but just anything in your mind that could be improved on.
That's a very good question. If I think about it, I think our improvement lies with the operations part of it, or the like ensuring that we can hire people as many as we need without being under a hiring cap, making sure that our purchasing and our financial paperwork is processed very quickly, making sure we get more legal support to attend to legal cases. We just can't compete with the corporate sector in these areas because we work for the people of Rhode Island and for the governor. So our salaries, our funding for programs comes through federal government, CDC, Centers for Disease Control and Prevention, Environmental Protection Agency, Health and Human Services, HHS, Medicaid and Medicare, who am I forgetting? HRSA. So those are the different federal funding sources we get, and we get very small amounts of fund from Rhode Island legislature. So I think that's an overarching thing that I see, which would need improvement. Programmatically, a lot of programs, there is a need, but in the absence of funding, we are not able to do as much work as we possibly can. And one area that comes to mind is prevention. If we had more funding, we could do prevention. We also need more funding for food inspectors, for inspectors to go and make sure that the hospitals and the clinics and the healthcare facilities are all functioning optimally. That's a state funding that we are short of. So those are like more people at the laboratory to conduct quick testing. So again, as I said, funding, operations are the areas that I see we can improve on. Does that answer your question?
Absolutely, thank you.
Mm-hmm. One thing I didn't mention is Rhode Island is one of 3 states in the country that does not have a local health department. So I believe it's Hawaii, Delaware, and Rhode Island where it's only the state health department. There is no local board of health. There is no county health. There is no regional health as compared to even our neighboring states. So so that's kind of that presents a great opportunity, but also a challenge. And the opportunity is in the form that, we get to work for the whole state as a singular entity. We don't have to go through cities, towns, regions, counties, boards. And the challenge is if we don't have the resources and if we don't work on that, nobody else will. So, whether it's the pandemic, whether it's prevention programs, whether it's direct services, case management, inspections, whatever it is, it's the Rhode Island Department of Health that does the work because of our structure of not being local. Does that make sense?
Mm-hmm. Yes.
Okay. I think, are there any other questions? And if not, I will hand it over to Jennifer to continue, but it's always a pleasure and very exciting to have new people join RIDOH as public health scholars, as interns, as new employees. Jennifer has my contact information. Currently, I'm on the 2nd floor in the corner, but I'm moving upstairs to 401 at some point when I have some time. So please feel free to reach out should you need to schedule a time to meet. It's always exciting to hear your perspectives on what's happening at the department and what your impressions are, and happy to provide more information. Okay, thank you so much. So Jennifer, I'll hand it over to you. Thank you.
Great, thank you.
Yeah, bye.
All right, I'm just going to share my screen again. All right, so my name's Jen Ritchie. I am the RIDOH Scholar Program Manager, which is our internship program for those who are not familiar with the terminology. So our vision and mission, our vision is to achieve excellence in public health policy and practice through academic collaborations and a multidisciplinary approach to public health in Rhode Island. Our mission is to strengthen the integration of scholarly activities within public health policy and practice by instilling a culture of learning to support RIDOH's leading priorities, which is what Seema was discussing earlier. We are an academic health department, which means we are a teaching health department that establishes formal affiliations between academic institutions and different public health organizations. We are designed to enhance public health education, research, and services through facilitated collaboration between academic institutes and public health departments. We also are part of the Public Health Foundation's Council on Linkages between Public Health and Academia. So that's something we are regularly collaborating and working with just to stay up to date with different strategies. This is our working organizational chart. So you can see Lori Leonard is the director of the RIDOH Academic Institute. We have different academic advisors who join us, when we need a little bit of extra help, and subject matter experts to discuss things. So Lori also oversees the public health research, integrity, and accreditation within the Academic Institute. This includes the Institutional Review Board, or the IRB, and then also the Public Health Department Accreditation and Quality Improvement and Lean. And if I move over to the left, the Public Health Education and Research, this is where I come in. I collaborate with many academic partnerships, making sure we have students coming in and out. We really enjoy working with students, and we really want to be part of shaping and molding the future of public health in the workforce. And then also Public Health Scholar Program, which I mentioned. And then we have the Public Health and Healthcare Workforce Development, which is led by Rachel Sardinia, which includes the Public Health Education Exchange, and then also the Train Learning Management, which we use to promote a lot of different types of trainings, whether it is, Public Health 101 and internal training, or also with our partners outside who maybe want to offer CE credits, or just want to get some training out there for their employees. We have a lot of different types of training opportunities that go through Train. And then we do have a couple different work groups and committees. We have a steering committee for the Academic Institute. We have different work groups to help collaborate with partners. And then we also have the Institutional Review Board. So for research integrity and accreditation, we have 3 leading initiatives. We have the Institutional Review Board, which is to ensure the privacy of the individuals. Privacy of individuals is not violated when research involves data about people. We also have the RIDOH Accreditation, which is to measure RIDOH's performance against nationally recognized practice-focused evidence-based standards. And then lastly, we have the Quality Improvement, which is to improve RIDOH efficiencies through use of continuous quality improvement. So quality improvement really is weaved throughout the department, and the Academic Institute kind of, touches all different areas of the department. We really are weaved throughout all the programs, which, if you remember during Seema's presentation, she was talking about cross-cutting strategies, and the Academic Institute and the Health Equity Institute are included in those. To talk more about the IRB, we convene the RIDOH Institutional Review Board to review all proposals for research involving RIDOH data. We work with a lot of different partners who use our data to move forward with different research opportunities. And this is kind of our way of, controlling who sees our data, was by creating our own IRB. The purpose is to assure protection of rights, welfare, and well-being of human subjects involved in the research. The Academic Institute's role in accreditation, we collaborate with the RIDOH division, centers, and programs to achieve accreditation objectives through measurement of RIDOH performance against nationally recognized practice-focused evidence-based standards. So the accreditation process really forces us to, hit the highest standards possible and stay at those standards. So we always, we started getting accredited in 2015. We were reaccredited in 2020. And then I believe it's a 4-year process where I could be wrong though, but I believe it is. And the purpose of the Public Health Department accreditation, it's a voluntary national accreditation program for public health departments. And the main goal is to improve and protect the public's health by advancing the quality and performance of public health departments. Quality improvement, the Academic Institute's role is to support the culture of quality improvement across RIDOH, and that through identification of QI technical assistance for RIDOH programs. The purpose of quality improvement is to improve the quality of public health policies, programs, processes, or infrastructure. And we are doing that based on performance standards, measurements, and acceptable QI practices in public health settings. So we're going to move on to the public health education and research area of our institution. It's really mainly about integration of public health practice in the academic research. So our first bucket is collaborative academic partnerships. So these are partnerships between RIDOH and academic faculty to address research questions based on RIDOH's public health policy and practice. We have partnerships with almost all of the colleges in Rhode Island, which we will talk about in a little bit on another slide. The RIDOH Public Health Scholar Program, which is what I manage. It's a collaborative public health research that drives learning experiences and research conducted by RIDOH Public Health Scholars. We have before COVID, we had about 120 students join us each year. And right now we're about to hit 50, which is really exciting because during COVID, we actually did still have some students join us, but it was, a very small amount compared to what it was. I apologize if you can see my cat who is jumping up on me. And then lastly, we have the Public Health Education Exchange, which are partnerships between RIDOH, academic institutions, and different providers who inform an online repository of continuing education opportunities. This is Train, which I was talking about, but we also work with a lot of different community partners and academic partners to help them also use Train. So it's not just a RIDOH internal department strategy that we have. We do open it up to other communities and partners in Rhode Island. Here is our collaborative academic partnerships, which I mentioned. So we have partnerships with all of the colleges except for 3. And actually soon Bryant will be added to our list of current partnerships. We are working with them to hopefully collaborate with their engineering program, which is a little bit different than what you would expect. And then also we are hoping to kind of get into the finance and business areas because, when we think of public health, we really don't think of those, career paths, but we have a fiscal department. We have different areas that, may not sound like public health, but, we do work with a lot of different people that are considered outside of public health. RIDOH is an active research partner with many academic institutes. We identify shared research interests and funding opportunities, and we conduct collaborative research that benefits public health. So if there is any funding sources that we can collaborate with partnerships, we do try to move forward with that, especially if it helps, fund compensation for our students who work with us. Sometimes we have funding built into our regular grants and proposals, but when we work with different institutes who are able to collaborate with for funding opportunities, it really is helpful because not all of our programs are able to compensate their scholars. Then we have the Public Health Scholar Program. So we have 2 different scholar project models. We have your typical, there's a project that needs to get done. A RIDOH program is looking for a student, and they interview and choose a student who works with them, and they work together on that project. And then we also have a collaborative public health research model where a RIDOH program and academic faculty, they have identified a research opportunity, and they bring in students to assist with that. So it really is a different approach than, you know, a more normal internship that you may think of. But yeah, they identify a shared research interest, and then they collaborate. We do have a lot of RIDOH scholars come through and do all different types of levels of work, which is, it's exciting. So this is actually goes into what I just said. So we have a lot of different levels of scholars. We don't use the terminology, you know, observational, junior, senior, advanced scholar, but it just helps us break down, you know, the different levels of students that we work with. So an observational scholar is going to be a high school student or undergraduate student, most likely is going to be some form of shadowing. There's no faculty engaged typically. Typically, there's no products that come out of it because it really is only a shadowing, one to three visits with RIDOH, just to kind of introduce, you know, what we do to those students. High school students are not, they don't come through very often. It is something that we are looking to move forward with and expand, and hopefully have, you know, a formal shadowing program in the future. We then have our junior scholars, which are undergraduate students. There's potentially collaboration with faculty. Something always comes out of a junior scholar's work. So whether it's a poster or a presentation at RIDOH, you know, there is a outcome, a product that comes out of that. And it usually is 20 plus hours of a commitment. We then have a senior scholar, which is an undergrad or a graduate student. There could potentially be engagement with faculty. And then there's a little bit expanded ideas for projects that we can do. So it could be an abstract, a poster, you know, they could go to a regional or national conference and possibly present at that. You know, they could be presenting their poster. And then also it could be like a policy or data brief. There's a lot of different things that could fall into this. And it's nice because students leave and they have a product that they can show their work and what they did with us. And this is going to be a 90 plus hour commitment. Advanced scholars, we have doctoral, clinical, or graduate candidates that come through RIDOH. It is typically with an advanced scholar, there's always engagement with the faculty. For examples of products, it is pretty close to the senior scholar, except there are a little bit more options, you know, a manuscript, reflection of the rotation, an abstract, and then the minimum time commitment is typically just dependent on their needs and what is going to qualify them for their academic requirements. So these are some of the opportunities that the Public Health Scholar Program offers. As I was mentioning earlier, we haven't done Public Health 101 series since the summer of 2019. So it's really exciting that we are back here, and you know, we do have about 3 or 4 months of different presentations lined up, which is really exciting. So Public Health 101 series, the goal is to learn about RIDOH's diverse public health programs and comprehensive work toward achieving RIDOH's leading priorities. It is, as Seema said, it is very intimidating coming in, whether you're a student or a new RIDOH employee. So this is really a great way to kind of introduce yourself to the different areas of work that we do, and, you know, also to get to know the staff and, you know, where they work and what they are able to do for the Rhode Island communities. We also have our RIDOH Public Health Scholar Poster Symposium. So we aren't doing this for the summer semester, but we will be implementing this back into our routine for the fall semester. We always require public health scholars to develop and present posters based on the projects that they're working on at RIDOH. And then we have a poster symposium where students can present their posters and RIDOH staff are able to come through. We typically have it either in the lower level or the lobby in the Cannon building. And so, we usually hold it during lunchtime. So different employees can come down and they can, look at the great work that students are doing. And then also it's a little bit of a networking event where students are able to discuss what they've done with the department, and employees are able to, ask questions and just learn a little bit more about the work that the student has been doing. We also have the Public Health Scholar Journal Club. Also has not happened since COVID started. It really is an opportunity to have an active learning setting in an informal way. So students are able to discuss scientific papers or publications, and typically either myself or another RIDOH Academic Institute staff member. Sometimes we have other individuals who are interested in doing this, but typically it's with one of us who holds the meeting for the scholar program. The Scholar Journal Club. Then we have our poster development sessions, which is associated with the poster symposium. We hold typically about 3 per semester. And it really is just a great opportunity for students to learn more about the poster template and format, the different types of information to include. We go over the award criteria because we do, for this symposium, we do award first, second, and third place. Dr. Nicole Alexander Scott had typically always joined us, and she would award the different places for the awards. And then lastly, we have a public health scholar social event. So we usually, after the poster symposium, we have a small little gathering where all the scholars come together, their supervisors, and we also invite the academic faculty to kind of join us and just celebrate the great work that we've done. And also it's a great networking opportunity for students to meet each other. And just, it's kind of like a celebration for a job well done. All right, we're going to move into our last area of the Academic Institute, which is the Public Health Education Exchange. I apologize, sorry, this is the last one in the education and research area. So we are really working on expanding the power of continuing education. This is one of the things we are working with Train to do. So we are increasing the accessibility to continuing education credits, which are also referred to as CEs. We are expanding the opportunities and career pathways information for current and future health professionals. We engage with many higher educational institutes as well as accountable entity partners. And we are working to develop a clearinghouse, which is what we're using Train for. And it's really a one-stop shop where we're able to offer content-specific trainings for health professional education and continuing learning. As I said, it's a one-stop online presence, so we are able to direct people to training, whether it's for credit, not for credit. We're able to deliver that through Train, whether it's through a classroom, a workplace, or online. We do use Train for registration for real-time outside of the internet world. So it's nice. You can use Train to promote different types of platforms, whether it's on-site or online. We also describe career and career pathway options across the state, and we link the Academic Institute web pages to those different career pathways. We are also utilizing the Public Health Foundation's Train learning management system, which is really exciting. We're able to include CEs developed by academic institutions, as well as RIDOH and other state agencies and community partners. Our target populations are current health professionals, health profession students, and then Rhode Islanders interested in health professions. So we also run a high school shadowing program where we are able to set up different rotations for students who are interested in the clinical side of healthcare. This program currently lives under the oral health program. We were able to use funding for an oral health grant to introduce different dental programs, but also we were able to widen the net of those professions. So that is something I also manage, and hopefully we will be transitioning that program into the Academic Institute so that it kind of, we're able to collaborate a little bit better with our partners. All right, that is it for me. This is my contact information. I will do questions in a second, but I just want to leave this up for a little bit of time. If there are any students or managers on here who want to talk a little bit more about the Scholar Program or just the different things that we offer in the Academic Institute, I would love to discuss that more. Let me unshare my screen. All right, do we have any questions? Pretty straightforward. All right, well, if we don't have any questions, then we can wrap up. We do have we have 2 more presentations next week. I believe it's the oral health program and I think it's Center for Emergency Medical Services. So those will be on Monday and Thursday from 9 to 10. If you haven't registered for those yet, you can go to train and register those. If you don't have the information, please reach out. Thank you, Victoria. I appreciate that. So yeah, so we will have 2 more sessions before the holiday. I will be sending out a much more lengthy schedule once we have the training links set up or registration links set up. And if that's all we have, then it was great to have everyone here. I'm super excited to keep moving forward with these. All right, I will see everyone next week, hopefully.
Thank you.